Hello everyone. I hope everyone is doing good on this beautiful day. I am Angela Metcalf and I am from Southern New Hampshire University. Today I am here to talk to you about the psychological views of eating disorders. What is an eating disorder? What goes through a person's mind who has an eating disorder? And how harmful or dangerous is it really? Types of eating disorders. Anorexia nervosa, also known as ANA, is a mental disorder where the person does not eat or they starve themselves. Binge eating is known to many as overeating or a stress eater. This leads to obesity. Bulimia nervosa, also known as MIA, bulimia is a mental disorder where a person does not want to keep food inside of them. They go without eating for a time period of which they proceed to go on a binge and purge spree. To purge is to cause one's self to throw up. They may do a purge because of guilt, or if they must eat they feel as if it needs to be expelled from their body. All eating disorders are some form of a mental disorder. Anorexic and bulimic people all have body dysphoria, according to the DSM-5, Statistics of Eating Disorders in America. Bannister Nutrition has provided us with this statistics chart. Studies show that an average American woman is 5 foot, 7 inches at 140 pounds, although, an average female fashion model is 5 foot, 11 inches at 110 pounds. What is wrong with this picture? There is plenty wrong to the point that it has put Americans in a place of influence. Here the chart says that 10 million women and 1 million men battle either anorexia or bulimia. In America, 13 million men and women are binge eaters. People spend a whopping $40 billion a year on weight loss programs or weight loss supplements. When we look at more statistics, 42% of children in from the 1st through the 3rd grade girls want to be thinner. And then it gets worse because children are affected to the point of 80% of all 10-year-olds, boys and girls, are afraid of being fat. There has been a significant increase in hospitalizations from 1999 to 2006 that children under the age of 12 have risen 119%, 37% of men, and 18% overall. The psychology of eating disorders. Almost 50% of people with eating disorders meet the criteria for depression. Eating disorders have the highest mortality rate of any mental illness. According to Castellini, Giussellini, Enrica, 2014, A Phenomenological Perspective, the core dimension of the disease of subjects with proneness to eating disorder behaviors also encompasses the perception of space, as well as the subjective experience of time. Several behaviors and cognitive distortion can be derived from a basic sense of spatial metamorphosis that is deeply associated with the disorder of corporeality. The subjective perception of time in eating disorder patients appears to be connected with the temporal discontinuity of the representation of one's own body, and the need of predictability of one's own life, which is achieved, failed according to control of eating and weight. The psychopathological core, rather than behavioral abnormalities, plays a crucial role in the onset and persistence of these disorders. Indeed, it has been associated with different responses to psychological treatment in several reports, and some authors have pointed out that the threshold to define the full recovery process might be body shame, appearance schemas, and thin ideal internalization. Therefore, these may be fruitful targets of intervention among those on a recovery trajectory. Trial and error research study on eating disorders. Goldschmidt and his team used the population-based sample of N equals 1,902, which came in the way of surveys at 5-year intervals. This helped to span through adolescence and young adulthood. The trajectories of not overeating and binge eating disorder, BED, which showed recurring distress characterization using the cross-tabulations method. BMI, depressive symptoms and self-esteem, and body satisfaction were examined as risk factors for not overeating, and binge eating disorder were surveyed again 5 years later using the multinomial logistic regression. We found that all overeating categories tended to remit to no overeating at 5-year follow-up. Although overeating had the lowest remittance rates at each time point, binge eating and BED showed higher rates of persistence or worsening of symptoms during the transition from late adolescence, early young adulthood to early, middle young adulthood, eating disorder caused by research. Jacobi and Fittig, 2010, had done a 3-year study of 236 college-age women who had potential risks for an eating disorder as the control group versus the people who had interactions with eating disorders. At the end of their study, the outcome was not very good because 11.2% of the women had either a subthreshold or ended up with a full eating disorder. How can we help as a professional? Continuous research for anorexia nervosa and related eating disorders, UNRED, will help make leaps and bounds in the future of treatment. Cognitive behavioral therapy is a type of treatment that can help with the mental illness, the stress of the eating disorder, their dysphoria, and self-esteem. Eating disorder rehabilitation centers have found by UNRED's research that only 60% of people with eating disorders fully recover from eating disorders. Meanwhile, 20% of people only make a partial recovery, whereas, the other 20% doesn't make a recovery at all. Self-help guides can help keep a person that is recovering on the right path because someone with a severe mental illness cannot be successfully helped with just guides alone but can help keep someone on the right path. In my personal opinion, I believe that support networks are the most important help when it comes to being rehabilitated. You need people who are there for you or who can share their story, experiences, and their helping ways of their recovery.